low dose statins that we give. Well, let me share a clinical insight that often gets overlooked. You might be testing lipids at a wrong time, and that mistake can throw off your entire game plan. When someone is acutely sick, for example, with COVID, the flu, or even a mild infection, their lipid panels change dramatically. So, to be more specific, LDL and HDL can drop to be around 10 to 30%, and triglycerides can rise up 10 to 50%. Why? Inflammatory cytokines like IL-6 tells the liver to make immune proteins such as CRP, fibrinogen, instead of lipids. And even the liver upregulates LDL receptors, pulling LDL out of the blood. Yeah, so triglycerides rise because increased VLDL output is happening and suppressed lipoprotein lipase and stress hormones like cortisol, driving fat breakdown without the clearance. So let's look at our favorite virus, COVID-19. And during the acute phase of this, studies like Sheen et al., it was in Clinical Chemistry 2005, showed dramatic drops in LDL and HDL. But post-COVID, we see the opposite. Wang et al. 2023 found persistent dyslipidemia, even in people without diabetes or obesity, a sign of long-term metabolic and endothelial disruption. So what if you tested your patients right after recovering from COVID or another viral illness? You might be chasing numbers that don't reflect the real baseline. So on the flip side, if you're seeing elevated LDL and triglycerides, think chronic inflammation, like sinusitis, chronic ones, periodontal disease, hepatitis C, and NASH, even undiagnosed insulin resistance, can all drive high HDL now and triglycerides opposite of what acute presents. And added the medication like steroids, and now you're really going to mislead all your labs. So here's the clinical pearl. Don't test lipids during or right after illness. Wait for 4 to 6 weeks post-recovery or for an acute read or accurate read. And if lipids are stubbornly high, stop throwing statins. Start looking for inflammation, hormones, or hidden infections, because sometimes the cholesterol isn't the problem. It's the signal. So that's our Andrew Allen tip of the week.
There you go. Thank you so much. Okay, so first off, I'm going to introduce our speaker tonight, Ross Pelton. He's been with us before, but no one has yet commented on the fact that with the new logo, I corrected all the spelling errors. It took 4 weeks for someone to even mention that they were there, and I knew that they were there when we originally drew it. I wanted to see how long it would take for somebody to say something. It took 4 weeks, but I corrected the spelling errors now, so I hope everyone's happy. So tonight we have a return. We have Ross Pelton, who's one of my favorite speakers. He's as he calls himself, a recovering pharmacist. We're going to be talking about utilizing membrane lipid replacement to repair, replace, renew cellular and mitochondrial membranes and increase ATP production. I got a text message. Great job correcting the spelling. So thank you. Okay, Ross has more than 30 years of research and scientific experience, and he's turned his passion for educating people about their health and life extension into a legacy for thousands of clients around the world. He's currently the scientific director for Essential Formulas based in Dallas, Texas. He's an expert on pharmaceutical drugs and life-altering side effects. He's a certified clinical nutritionist. He counsels clients on diet, nutrition, natural therapies for a wide range of issues. As a health professional, he helps clients and other healthcare professionals utilize and integrate natural therapies and life extension technologies into their lives and their practices. He tackles tough subjects like natural therapies for depression and anxiety, ADD and ADHD, preventing side effects of birth control pills, and natural therapies for sleep. He covers a myriad of topics and speaks frankly about what you need to do naturally to take charge of your life. They would not have liked you at the Androgen Society. They're all strictly by the book there. There's no such thing as an herbal remedy that works for pretty much anything. He began his career in health sciences, graduated from University of Wisconsin School of Pharmacy in 1966. Wow. He was a pharmacist for a number of years. He joined the Peace Corps in 1972. He taught high school chemistry for 2 years in Malaysia, and he closely observed the village shamans and native healing arts in Malaysia, Thailand, and Indonesia. He began doing research in cancer at the University of California, San Diego, with Dr. Gerhard Schrauzer. I hope I said that right. And the relationship between selenium and breast cancer. They added trace amounts of selenium to the drinking water of mice, and 85% of the control mice developed mammary tumors, while less than 15% received trace amounts of selenium developed tumors. Have you followed that up at all?
I'm still a big proponent of trace mineral selenium.
Yeah.
Dr. Schrauzer died,
Mm-hmm.
and I was working with him to get my PhD, and I quit that program. I
Okay.
was in charge of the mouse colony, and I had to take the mice and grab them by the neck and wrap their tail around my finger and immobilize them and take a glass pipette and scrape it in their eye and cause their eye to bleed to suck blood out for blood samples. And it was driving me crazy
I was
just
going to say
torturing
that
these
doesn't sound
animals.
like fun.
And so I quit.
That's not a fun job. But any follow up on selenium for
Well, so yeah, selenium still has a great profile for a lot of things. There's a lot of research about low levels of selenium being associated with increased risk to prostate cancer, and there are lots of age-related diseases are somewhat associated with low selenium levels. And one of the problems is that most of the soils in America are depleted of selenium because of factory farming and no crop rotations and all that sort of stuff. So it's something that I think everybody could, or most people could benefit from. Just doing like 1 part per million of selenium a day is a great way to get your selenium supplemented and very little cost involved.
Mm. And it says in here in your biographies that selenium could result 70% reduction in breast cancer.
This is in mice, yeah. The C3H mice are bred to develop breast cancer. So we use those mice and divide them into two groups, and one group got trace amounts of selenium in their drinking water, and the other was controls, and 85% mammary tumors developing in the placebo group and 15% in the selenium group. So 70% reduction in mammary tumors with just trace amounts of selenium.
Was there never ever any follow up on that in any humans studies at all?
No, I mean, I quit that program and I just continue to keep an eye on selenium, but I haven't done any follow-up on the research actually.
Well, none of us are getting any younger. I think, we need a legacy here. Okay, I see Dr. Quinn's got a shirt on, so it's got to be, it can't be more than 110 in Vegas. So, by the way,
Yeah, you got
um,
that right.
Ross, in 1988, Ross and his wife Taffy moved to Baja, New Mexico. He became a hospital administrator at one of the largest hospitals specializing in alternative cancers. He was a consultant at the Gerson Institute. We were talking earlier, Dr. Pelton, Dr. Ross, about straight as an arrow, versus expanding your horizons. I actually sent a patient to the Gerson Institute from Northeast Pennsylvania. I think it was in 1991. I was in a group of 52 doctors, and they threatened to kick me out. I was put on double secret probation because of that. That was against their mantra. So give
Yep.
them cis platinum and kill them in 6 months. That was a better that
More
was a better
people die from
solution.
chemotherapy than die from
Yeah.
cancer.
In 1994, Ross became a certified clinical nutritionist. He teaches 2 weekend seminars for health professionals who aspire to pass the exam and become certified clinical nutritionists. Ross has authored many books. The Drug-Induced Nutrient Depletion Handbook is one of mine that sits right here on my desk that I use all the time. Nutritional Cost of Drugs, Natural Therapeutics, Alternatives in Cancer, Mind Food, and Spark Pills. Ross is an educator. He's been with us a couple of times, and he's going to enlighten us tonight on utilizing membrane lipid replacement. So I give you Ross Pelton, and thank you for being with us.
Okay, thanks, Bill, for the introduction, and I'm glad you're all on to share a little time with me this evening. Before I get started on my topic for the evening, I'm going to toss out a couple things that are popped into my mind as Bill was doing my introduction. Any of you can get a free copy of my drug-induced nutrient depletion guide by just sending an email to naturalpharmacist.net/DIND, which is drug-induced nutrient depletions. And I'll send this to Bill, and you can post it in the show notes, Bill.
Okay.
So another thing I've recently gotten very passionate about, and this is somewhat of a controversial topic, but I want to toss it out. I've gotten really interested in the pandemic and how I think it was mishandled, and the vaccines that have been developed, which I think are very harmful. And so there's two books that have been published. One is called Canary in a COVID World. A second volume is called Canary in a Post-COVID World. I got so impressed by these books, and there's 34 chapters in volume 1, 37 chapters in volume 2. Every chapter is written by a different individual that had the courage to speak out about these issues. It's fascinating reading, it's good science, and it's pretty disturbing. But I encourage everybody to read these books. And I got in touch with the publisher and got the publisher's permission to reproduce and distribute 4 of the chapters from these books. And so this is a good way to get introduced to the topics in these books. And I went and wrote a book review or a review of these 2 books. And my book review has been published in Health Freedom News, which is a magazine produced by the National Health Federation. And then my book review has also been published in 2 medical journals, the Townsend Letter and also Integrative Medicine, peer-reviewed medical journal. So I'm just trying to get the word out and draw attention to these issues. So I'll send my book review to Bill so he can post it in the show notes. You can all have access to this. And in my book review, I have the hyperlinks to the 4 individual chapters that I've been authorized to distribute. So that's that topic. Now let me get into tonight's topic and share my screen here. There. So a little background and history about this topic of membrane lipid replacement, using membrane lipid replacement to repair, replace, and renew cellular and mitochondrial membranes throughout your body. And of course, mitochondria are where your energy produced, so this results in significant increased production of mitochondrial ATP. A friend of mine introduced me to this topic and these products a couple of years ago. And I dove into the science, and after I got exposed to this, there's no way I could not get involved. It's just such important information. So for the last couple of years, I've been increasingly getting involved with these products and starting to publicize the availability of the science that explains and supports and documents these products. I'm in the screen here on this first slide, I'm mentioning that there's over 60 publications on these products that I'm going to be talking about tonight. So it's well documented with good science. And if you go to the website there, ntfactor.com/research, all 60 plus publications are listed there, and they all have hyperlinks. So you can click on any one of the studies and take the hyperlink takes you the whole study. So you've got access to all this science. So I think that using membrane lipid replacement to repair and renew mitochondrial membranes, and although this is for all cellular membranes throughout your body, I'm going to really focus on mitochondrial membranes because your mitochondria are so critically important for your aging process. So I think this is really a revolutionary breakthrough in anti-aging, life extension, and regenerative medicine. So my key topics tonight, I'm going to dive into mitochondria and the mitochondrial theory of aging a little bit. I'm sure you're all familiar with a lot of this information. I'll talk about the architectural structure of cell walls and cellular membranes. And then I'll talk about phosphoglycolipids, which are the primary architectural structure of cellular membranes throughout the body. And then I'll talk about using these products, patented high potency phospholipids delivered to the body sourced from around the world, non-GMO, European standards, and protected with antioxidants and fructooligosaccharides. So that's the products that I'm going to be talking about. To begin with, I want to just cover a few things about mitochondria. 90% of our human energy is generated in the mitochondria, and there's some fascinating things about mitochondria I wasn't really aware of until I started diving into this research a little bit. Approximately 37 trillion cells in the adult human. You've got an average of 1 to 2,000 mitochondria per cell in your body. And cardiomyocytes, your heart is the most energy demanding muscle in the body, anywhere from 5,000 to 8,000 mitochondria per cell in the heart muscles. And so approximately 10% of a human's body weight are mitochondria. You got a lot of mitochondria, and as they start to age and dysfunction, that's one of the key factors of biological aging. So in 1956, Denham Harmon published the free radical theory of aging, really sent shockwaves through the medical and health communities, and it became a very famous and well-regarded paper. And then 1978, he kind of evolved the free radical theory of aging into the mitochondrial free radical theory of aging. And the mitochondrial free radical theory of aging states that increasing free radical damage to mitochondria and decline of mitochondrial energy production are key hallmarks of biological aging. So that's the main thing I'm going to be focusing on this evening. And one thing a lot of people don't realize is that our greatest source of exposure to free radicals every single day of our lives is the free radicals that are generated in mitochondria during the process of energy production. Though this is how and why mitochondria get damaged over time, because energy production results in electrons leaking and free radical damage. So I'm going to take a closer look now and discuss the architectural structure of cell walls and cell membranes throughout the body. It's called a lipid bilayer, and the primary ingredients or architectural structures are phospholipids, also referred to as glycerophospholipids. And on this image of the cell membrane, the rust-colored sections are the phospholipid bilayer. And so I do the analogy that these phospholipids in cellular membranes are like the 2x4s and the 2x6s in the wood structure in a house. They provide the architectural structure for cellular membranes. And just like the wood in a house over time, it can get damaged. You can get water damage and termites and all sorts of things happening over time. So that's what happens in cellular membranes over time. These phospholipids start to get damaged. So here's an image showing the structure of these phospholipids. You've got the phosphate group on top and the glycerol part of the molecule, and those are hydrophilic. And then the hydrophobic section down below are different types of fats. And so you can see that there's two legs, so to speak, on the phospholipid. One is a saturated fat and the other is an unsaturated fat. And it's that unsaturated fat in the structure of phospholipids that's an area that's susceptible to free radical damage. And free radicals attack or are more likely to attack unsaturated fatty acids at the double bond point. And so that's what happens over time. That's why these phospholipids in your cellular membranes start to age. It's primarily due to free radical damage at the unsaturated fatty acid arm in the phospholipids. So membrane lipid replacement is supplying concentrated phospholipids for an individual to take orally. These unsaturated fatty acids undergo oxidative damage, as I mentioned, but we're supplying people with a concentrated dose of healthy, non-oxidized plant phospholipids. And so the results or the benefits of this therapy It restores the structure and the function of cellular and mitochondrial membranes throughout your body, results in significant increases in the production of mitochondrial ATP, and it's actually slowing down and reversing one of the key hallmarks of biological aging. So I think this is really a big deal. And people really notice this, and I'll go through some of the scientific studies and show you the results that people get taking this product. Just on this slide, I'm bringing your attention to Garth Nicholson, who's a PhD, Chief Scientific Advisor for Nutritional Therapeutics. He's got quite a background and quite a scientific history. In 1972, Nicholson, along with Singer, published a study titled The Fluid Mosaic Model of the Structure of Cell Membrane. This has become a classic paper, and it still to this day remains the accepted model for cellular membranes. Nicholson received a nomination for the Nobel Prize for this work. He didn't receive the Nobel Prize, but he received the nomination. And Scholar GPS is an international service that ranks scientists around the world in many different areas. Scholar GPS ranks Nicholson as the #1 scientist in the world in cell membrane science and research. And he's got over 700 scientific and medical publications, and over 40 of his publications are on membrane lipid replacement. So he is really the key scientist that has done the studies that documents this program. In the bottom of this slide here, I'm bringing your attention to the most recent paper by Nicholson, published in Nature Cell Science. You can see that was 2024, just last year. And I hope you'll all access this paper and read it. The title here, Membrane Lipid Replacement and its Role in Restoring Mitochondrial Membrane Function and Reducing Symptoms in Aging and Age-Related Clinical Conditions. So this really goes through the whole science of how this works, why it works, and the benefits that people get. So it's a really great review paper for people to read. Okay, here's some of the studies. This study is titled Reversal of Age-Related Mitochondrial Functional Loss with Membrane Lipid Replacement. So at time 0, test subjects average age 69.5 years. So essentially 70-year-old people started taking membrane lipid replacement. And you can see on the left-hand scale, the bar graphs are measuring mitochondrial energy production. After 8 weeks, they gained mitochondrial energy production that took them up to a level that's equivalent to healthy adults about 29 years old. So really significant, noticeable increases in mitochondrial energy production in just 8 weeks. And the references are on the bottom here. In this slide, I'm introducing you to rhodamine dye, which is used in the pharmaceutical industry quite a bit. It's a fluorescent dye, and it can be taken up in healthy cells, and it has a green fluorescence, but it cannot be taken up into damaged mitochondrial membranes. The damaged mitochondrial membranes don't have the energy to make this dye fluoresce. And so you can see in a damaged mitochondrial membrane there's almost no green color visible. But in a healthier cell, you've got the very noticeable fluorescence in the mitochondrial cell membrane. They use this dye to document the benefit of people taking these products. They can expose their cells to the rhodamine dye before they've started taking the membrane lipid replacement products, and they see that there's very little green fluorescence. And then after a period of time, a couple of months, they again expose some of their cells to the rhodamine dye, and they can visually see and record the increased function of the mitochondrial membranes as evidenced by the fluorescent dye. On the images on the right-hand side of the screen, is showing, the top image is showing that over time, damaged mitochondria actually have physical damage and changes in the shape of the cell membranes. And down on the bottom right is a healthy cell that's been protected with membrane lipid replacement. It's maintaining its structure. So your cell membranes throughout your body, and especially mitochondrial membrane, those membranes have to be functioning for nutrients to be absorbed across the membranes into the cells so the cells can utilize these nutrients to do whatever work they need to do. So they did studies with membrane lipid replacement and showing that they increase the bioavailability of different difficult to absorb nutrients. CoQ10, curcumin, quercetin are some of the ones that were looked at. And this study documented that membrane lipid replacement in combination with coenzyme Q10 doubled the absorption and the plasma level of CoQ10. And CoQ10 is such a critical nutrient for both energy production and as a fat-soluble antioxidant to help suppress some of the free radical damage that happens from electron leakage in mitochondria. This is really a big story, being able to double the absorption of coenzyme Q10. A lot of the studies on membrane lipid replacement are related to fatigue, because when you improve mitochondrial function, one of the main things that happen is more energy and decreasing levels of fatigue. The Piper fatigue scale is commonly used to measure fatigue, number of questions that people are asked on a usually a weekly basis. So here you can see after 30 days, a significant drop in their fatigue scores. 60 days, another significant drop. So just showing that 30 to 60 days, there really are documented decreases in fatigue and increases in energy levels. This is a summary of a number of clinical trials, different people. The first one, aged individuals, age 70, people with fatigue, average age 50.3 years. Next column, chronic fatigue syndrome and fibromyalgia syndrome, average age there 44.8. And in the general fatigue population, 57 was the average age. Highlighted in red, I'm showing the reductions in fatigue in the Piper fatigue scale rating. And you can see down at the bottom there, 37% reduction in fatigue in just 1 week. So this stuff really does work. Piper fatigue score also measures a number of other factors. And so this is just documenting that there's improvements in cognitive functions and mood disorders, behavior, affective meaning, I guess, expression of emotions, and sensory, smell, and hearing. I'll get back to hearing in a slide a little bit later and emphasize that a little bit more. And just general overall fatigue. All of these areas improve significantly with membrane lipid replacement therapy. This study is looking at homocysteine and fasting insulin levels. And it's a 6-month study. And after 6 months, the left-hand image, 32% reduction in homocysteine. So you're lowering homocysteine and reducing cardiovascular levels, cardiovascular risk levels. And it lowered homocysteine levels from dangerous levels back into a safe level. And the right-hand image here is the lowering fasting insulin 6-month study, 59% reduction in fasting insulin. So you're really lowering all-cause mortality significantly by getting a pretty dramatic reduction in fasting insulin levels. This is a fascinating study that I'm going to discuss next. It was done with veterans from the Gulf War who were exposed to significant amounts of chemical, biological, and environmental toxins. The lives of these veterans were ruined. They were significantly damaged. And so Nicholson I highlighted earlier, is the lead author. And the participants here, the Gulf War veterans, took 6 grams per day for 6 months. And they assessed benefits by looking at a symptom severity form. There were over 100 symptoms, and they kind of categorized these into 22 symptom categories. And the veterans would rate each of these symptoms on a score of 0 to 10. And the symptoms were self-reported at 2 weeks, at the end of the first month, at the end of 3 months, and the end of 6 months. So these veterans who got their lives back, here's the improvements that they got: heart, nose and throat, breathing, neurological symptoms, sleep problems, fatigue, hair, skin, urinary problems, oral cavity, balance, eye, vision, senses, auditory problems, joint aches, muscles, allergies, infections, GI problem, pain, genital problems, chemical sensitivities. All these problems majorly improved and in many cases resolved for these veterans within 6 months of being on the membrane lipid replacement therapy. And one of the other things we learned from this study is that these lipids, the membrane lipid replacement, you're supplying the phospholipids, they absorb hydrophobic, it's supposed to be hydrophilic. I've got a typo there. It's fat soluble toxins from the body. Your toxins are fat soluble, they get stored in the body. This therapy typically is removing a lot of these different toxins that these veterans got exposed to. The other thing we learned from this Gulf War study is that the normal dose is recommended to be about 1/8 of a teaspoon. The Gulf War veterans started at that dose and really weren't making much progress. So Dr. Nicholson dramatically increased the dose from an 1/8 of a teaspoon up to 6 grams, a little bit more than a teaspoon. So this is a huge increase in dosage. But then significant improvements started to happen pretty quickly. Within 3 months, they were all making major improvements. And at the end of 6 months, a lot of these things had been resolved. If you go to the study, I've got the reference down below. They've got graphs on each one of these symptoms showing how much they improved and over what time scale improved in the 6-month period. Comment about age-related hearing loss and a study that was conducted. I'm certainly suffering from age-related hearing loss myself, and it's one of the really frustrating things about aging if you're experiencing it. So they did a study, influence of membrane lipid replacement therapy on mitochondrial function, DNA damage, and age-related hearing loss. This is a study done on on rats. Took rats and divided them into 2 groups, and for 6 months is either the placebo group or the membrane lipid replacement group. They measured hearing sensitivity, mitochondrial function, and mitochondrial DNA damage. Significantly slowed age-related hearing loss, preserved the hearing in the mice being treated, protected mitochondrial function. Treated rats retained stronger mitochondrial function and sustained cellular energy production and reduced DNA damage. So this is actually slowing down one of the primary hallmarks of aging, increased DNA damage over time. There's the reference for that study. So just summarizing some of the results here, with these membrane replacement therapy products, people get improved mitochondrial function, improved cognitive function, improved cellular detoxification, increased nutrient absorption, slows down the process of biological aging, removes lipophilic toxins. People get more energy. It's really quite noticeable. And you're increasing not just lifespan, but also health span. So membrane lipid replacement is a scientific term, and all the scientific studies where you can't be commercial, they talk about membrane lipid replacement. But here's the products that are marketed by nutritional therapeutics. NT factor lipids is the name of the products, and actually improving mitochondrial function. And again, I mentioned all the science is available on this website. And
There's a question about the fact that the NT factor is soy based. Is there?
There, some of them are extracted from soy, and then they have a non-soy based product that's for people that might be sensitive to soy.
Okay.
In defense to that question, anti-factor is actually what we call purified lipids. Even though it's soy derived, these are not whole soy or soy protein, which are considered allergenic. So meaning it has been removed in relation to those allergenic components. And at the same time, it's non-GMO, as far as I remember, in terms of my research about this. Non-GMO soy is being used in these specific products. And as you mentioned, Garth Nicholson had proven this in so many studies in relation to the effects in terms of fatigue energy and membrane integrity, again, without the soy-related adverse effects.
Yeah.
So I think in defense of that NT factor, it really has observed these specific indications.
And there's no soy proteins in it. It's just the phospholipids that are extracted.
Right, more purified lipids. So they're not whole soy, no soy protein. Right.
Would it be considered an endocrine disruptor then with the soy?
Not that I'm aware of, no.
Okay.
No, I don't think so. Just because, again, with the Garth Nicholson studies actually didn't show any soy-related adverse effects. If it does contain these soy components that we're worried about.
Okay. Someone asked if they can use stem cells from rabbits.
Stem cells from mothers?
From rabbits.
Yeah. So I guess ask the question one more time.
Yeah, Michael Chen uses rabbits, and he takes stem cells from rabbits, from
Yes.
the organs. Are those stem cells used for human beings?
Yes, that's they extract them from the rabbits and they inject them into human beings, and they're specific pathogen free. So there's no pathogens, and the DNA structure of the stem cells from rabbits is almost identical to human stem cells. And so, and there's several different animals that are being used in the stem cell scientific arena. Rabbits are number one. Sheep are being used, and can't remember. There's a third animal I've seen referred to. I can't remember right now, but rabbits are one of the primary ones that are being used because they're so easy to raise. They reproduce fast, and so you get a good source of stem cells.
But is there any risk because those cells will become organs of the human being? They will become part of the cells of us. Let's say somebody injects stem cells from rabbit, then they develop into myocytes or something, and they will have the DNA of the rabbit.
Yep. And when you do these organ-specific stem cells, they get injected into your buttocks, but then the organ-specific cells migrate to the specific organ. Somehow the body has this knowledge that the kidney cells will migrate to the kidney and the heart cells will migrate to the heart. And so Michael Chan does a pretty extensive medical questionnaire and symptom survey and all your lab tests and so forth to find out which ones might be most appropriate for any individual.
And if they go into a human brain, they develop into a human neurons or rabbit neurons?
They develop
good
in
question.
human tissue. And And Michael Chan did a really interesting presentation a couple of weeks ago at RadFest, and he talked about improving brain function and had some interesting results with both an autism and also Down syndrome children. And the before and after images of these children were just astounding, that their whole change of their demeanor and the structure of their face and their energetic level was dramatic. I don't know how long they were on the therapy or how many times they got stem cell injection, but it's pretty dramatic improvement in their physical being.
Wow, amazing.
Petronella, you have to remember these are still used under research guidance. So again, specific recommendations of these specific products
Yeah,
are
so
not really
yeah.
up to the medical standard yet. That we're even, I mean, in general, stem cells are, especially here in the US. But I am aware of Dr. Michael Chan, and he did present his, I know, and one of the practitioners running his clinic also. And they do vouch for the good results of this. It's just weird to hear that we're getting stem cells from animals, right? And that's hard to accept, especially for conventional doctors. But with this colleague of mine who works with this type of method, they do see results with it. It's just really, you just have to kind of open your mind a little bit more about it.
Yeah.
Yeah, it was a doctor who came from Kazakhstan at when it was a conference with Academy of Stem Cell Physician, and he also used stem cells from rabbits. He talked about at the conference in March this year.
The other reason the rabbits are used is that they don't carry prion disease that you find with bovine, pig, or sheep.
Good point. Thank you.
That's really the most critical piece of information.
Yeah, it's called specific pathogen free, SPF is
Oh,
the terminology.
that's true. They are that, but it's known that the rabbit does not carry prion disease.
Yeah, good point. Thank you.
Yep.
Is there any possibility to get rid of prions? Because I read a lot of scientists, they're talking about in spike protein has a portion of the prion.
Bill, can you repeat that question? I have a little trouble with the accent. Sorry about that.
Oh, so I read in many studies that spike protein have a portion that is similar to prion. And I was wondering, is there right now any kind of technology that if somebody is infected with a prion, that we can remove that?
Yeah, I'm
To
not
remove
sure.
the prions.
Bill, are you there?
Oh, Dr. Ross, what she was asking is if there's a way to remove prions.
Oh,
Because
okay,
especially
thank
with
you. Not that
relation
I
to
know of. Not that I know of. However, one of the things I mentioned earlier was these two books on COVID, and a couple of the authors in those books have a long COVID protocol, and so there's a lot of people suffering from long COVID, and there are some various, I think it's 3 different nattokinase and a couple of other herbal products that are being used to help with long COVID.
Is that Peter McCullough's group? Is he one of the sponsors there? That in those books that you mentioned?
I missed that.
Peter McCullough, he's a big proponent of nattokinase.
I'm not familiar with that work.
Nattokinase, you just mentioned it.
I'm familiar with nattokinase, but who you're talking about is a big proponent of it.
Peter McCullough?
Oh, Peter, yes. Peter McCullough is the guy that has a protocol in the chapters that I'm making available. He actually discusses his long COVID protocol.
Yeah, so it's nattokinase. It's 100 units. I think it's 100 milligrams twice a day. Betaine, I forget the dose on that, once a day, and curcumin, 500 milligrams twice a day. That's the protocol.
Thanks for
there
that.
You go. You don't have to go buy the book. I just gave you the answer. Okay. So Dr.
So
Sanders
somebody
writes,
close
there's
to being
cosmetic
out of
results, hair growth, and integrity, skin integrity using plant-derived stem cells. Seems humans can incorporate stem from different organisms and use to stimulate growth factors. Same thing you said, Ross.
Yeah.
Okay. Someone asked about different types of cancers and with the NT factor. Any experience with that?
No, they haven't. I mean, with cancer patients, there's tremendous improvement in symptoms, the nausea and the vomiting, and the weight loss and the energy loss and so forth. But they're not going out on a limb and recommended it as a cancer treatment.
Right. Okay. Okay, Dr. Naria, do you got any email questions?
Yes. So one of the bigger questions about NT factor versus its proponents. So I'm sure you've heard of lecithin, for example, and
Yeah.
even choline
Yeah.
as lipid replacement supplements. In relation to that, what makes NT factor different from these basic lipid replacements?
Much more concentrated, and I think that's the big difference. It's not just one or several, but it's a wide range of these phospholipids and a concentrated dose and protected with antioxidants so that when you're taking them and they're being delivered, they're healthy, non-oxidized phospholipids.
Yeah, and I think to add to that, is there a special delivery method with anti-factor versus the as we know that the degradation of lecithin, choline, phosphatidylcholine in the GI tract happens. That's why there's only so much a small amount reaches the small intestines. Is there something that is proprietary with the delivery system of anti-factor?
I'm not sure about that. I don't know. It seems to be absorbed by mass action. Garth Nicholson wrote about this in a couple of his papers. So higher doses, you're getting more, the body's just able to absorb more of it, and then it absorbs more of the toxins for removal. So he talks about mass action being kind of the mechanism of absorption.
Hmm. Okay. Yeah, I just thought there was a special delivery system,
I
but
don't
still.
I mean, I'm not aware of a special delivery system, but the main thing that they talk about is the antioxidants and the fructooligosaccharides that protect them so that you're being assured of receiving non-oxidized healthy glycophospholipids.
Right, right. Here's another one. How soon can they expect to see changes? So you mentioned all of these symptoms changes, and how long when you're taking
Well, if
anti-factor?
you look at the Gulf War symptom veteran study, um, and there's a graph for all those 22 symptoms I had on the slide that showed improvements in all those different symptoms. Um, in the paper, there's a graph for each one of those 22 symptoms showing how much and how fast improvement over the 6 month period. And a lot of them started to show significant decline in those symptoms after 2 to 3 weeks or so. And by 3 months, many of them had huge drops. And of course, 6 months, it was even more. But a lot of them are starting to get noticeable symptoms relief on within first 2, 3, 4 weeks.
Right. And they have to understand that we're replacing lipid layers here. These are not things that you're going to be seeing in like few days in terms of the results. So it takes a while, and these are
Yeah.
damaged parts that you want to replace. So yeah, weeks, months probably would be an ideal, realistic perspective on that.
Yeah.
And another one, is there a ceiling effect for MLR? Or is it something patients should continue indefinitely, like maybe maintenance dose or suggested length of intake?
I'm going to do it indefinitely. I recommend that
Right,
people do it on a regular basis. Um, Improving mitochondrial function and slowing down mitochondrial DNA damage is something I want to do for the rest of my life.
right. And you have to remember, oxidative damage is happening every day. You
Yeah,
just getting
yeah,
stressed, a diet that we eat.
yeah,
So yeah, definitely this is something that you probably need to be on for a period of time, even as a maintenance maybe.
yeah, yep.
So what current research basically kind of you're seeing in the future of MLR in the clinical practice? And probably you, what do you want to see in terms of advancement for it?
Well, I would like to see a number of studies done, and they are kind of financially strapped. I mean, they put a tremendous amount of money into all these studies over the last 20 years. And they've got a couple of studies, as I mentioned, going one in Uruguay and one in Australia. But it takes a lot of money to fund these studies, and they're a little bit cash poor in terms of putting money into more studies. So I'm trying to help them market it and get the word out about how important it is.
Right. And I see there's a real huge part of this probably playing in cognitive health, especially with the uprise of Alzheimer's, dementia, every type of dementia out there. I think there's a big role for MLR to be part of that. I mean, I don't know if you heard of Dr. Kane. She's a big proponent of phospholipids in neurodegenerative diseases. So this is something that she has a protocol for this using phosphatidylcholine IV. But again, oral can definitely be something that always will be a contributor to this and to just to kind of speed up everything.
Yeah.
And in relation to, of course, the one of the things that you probably see now, and maybe your perspective, MLR and longevity medicine and other supplements that you can introduce to this protocol of yours. Are there anything that you can add to that?
Well, there's I've got other products that I'm really quite fond of that are really important for anti-aging and life extension and regenerative medicine. One of them is crystal-free coenzyme Q10.
Crystal free. Okay.
Crystal-free. Most people don't realize that coenzyme Q10's melting point is 10 degrees higher than body temperature. So it crystallizes. And we can't absorb clumps of CoQ10. It has to be single molecules in solution. There's a company out of Denmark called Pharmanord, and they have a process that keeps their CoQ10 in solution. And they've done clinical trials showing that they get anywhere from 3 to 10 times higher plasma level than other commercial brands. And I'd say a majority of the randomized double-blind placebo-controlled trials conducted with CoQ10 around the world over the last 20 or 30 years have used Pharmanord's crystal-free coenzyme Q10. I'll put a link to this. I'll give it to Bill so we can put it in the show notes so you can get in touch with Pharmanord and take a look at their product. But I think it's really important because CoQ10 is so critical for mitochondrial function, energy production, fat-soluble antioxidant. I think that coenzyme Q10 is definitely an anti-aging life extension nutrient, but it's really unfortunate so many people are spending money and it's like 1 or 2% absorption. I mean, it's really a shame. And so I'm really promoting this crystal-free CoQ10.
Right. Well, Dr. Ross, that was a great presentation. So you knocked all my questions out. Again, you're a common fixture for us. So definitely come back again and share us your knowledge. I think it's evolving every time we see you.
Yeah, we got a couple more questions, Ross.
Yeah.
Have you ever heard of fatty 15 for cellular membrane health, and how does it compare?
That's a new one to me. I'm not familiar with it.
Okay, we've had her on too. I remember her first name was Stephanie. That was my mother's name, and I forget what her last.
Will you send me a link to that so I can look into it?
Sure. How much coenzyme Q10 is recommended?
CoQ10, I take 100 milligrams a day for people that have cardiovascular problems or other health-related problems, chronic fatigue and so forth. I recommend 200 milligrams a day, but it should not be taken in one dose. You get higher absorption if you take 2 individual doses. 100 milligrams twice a day is much better absorption in plasma levels than taking 200 milligrams in one dose. And since it's a fat-soluble nutrient, you get better absorption if you take it at a meal that contains fat in the meal.
Yeah. Okay. So the fatty 15 person, her name is Stephanie Venn Watson. and I can probably get you the thing. So, and another question was about has the Veterans Administration shown any interest?
Have they done any what?
Has the Veterans Administration shown any interest in any of these types of therapies?
Well, Garth Nicholson worked with the VA to get these Gulf War veterans enrolled in a study, but and he actually has been honored by veterans somehow. He got some kind of an honorary degree or something based on his work for veterans. But in terms of the government itself, that's a pretty slow process to get them involved in things.
Okay, I'm getting you the Fatty 15.
Thank you.
But since 2021, they discarded it.
Dr. Tano, are you talking about a blood test resulting into metabolite results?
Yeah,
Is that what you're saying?
yeah, right. Yes.
Yeah, because as far as I know, the metabolites are usually more for urine. I mean, if you're just driving away from Dutch, there's UMAP from doctor's data, I think. I think Vibrant also has, but again, it's also urine. So that's why they test urine because the metabolism is already there. It's like byproducts.
Yeah, they
So I
all
don't know
have
if
the
there's
urine,
blood.
but I tried to do those, but they didn't give me
There you
satisfactory
go, Smitty.
results. Yeah.
Mhm.
Yeah.
And now the cryo freezer's not working. I don't know if we hit it when we turned off the surge protector.
All right, we got to get Dr. Gerber to turn off there.
Yep.
So, okay,
Say, Dr. Clearfield,
yes.
would you like to reach out to Dr. Brownstein about your iodine question?
I would, yeah.
All right. I'll send you an email with his email to you shortly.
Okay, I would.
All right.
Make it a
I just dropped him a line asking if it's okay to, share his contact info to you. And he said, fine. And you can propose whatever, you got information on that patient.
Let him know. And at home, I have his iodine. One of his iodine books is I actually use that.
Yeah, I'm sure you just so fine. Yeah. So anyways, he will probably run into that elevation a lot more commonly than most people.
Okay, thank you.
So give him heads up that Dr. Bill would invite him for a webinar also, along with that consult.
I'll let him know. Well, Bill, you can email him, and if I'm sure he'll share you his phone number. You can talk to him, ask him about that patient, and
you're going to invite me.
Say again.
Maybe I get invited for dinner.
Yeah. Well, just.
But I think he lives in Cleveland, right? Is that where he is?
Michigan.
No, he lives in the Farmington area of Michigan.
All right, it's near my daughter. Okay, yeah, they're off.
Yeah, I live in.
You live in
between Pittsburgh.
Yeah.
Hey, Dr. Nario.
Yes.
Dr. Mike Chan. If I'm correct, hasn't he been on Dr. Thomas Lewis's website or Zooms on Monday mornings at 9 and Wednesdays at 5? I think it is.
I think he appeared in, I think Farshan, I remember.
Farshant, yeah.
That's where I saw him, yeah.
That's right. Yeah, you're right. That's where I saw him. Okay.
Because it's the Stem Cell Society, so
Correct.
I think that he got invited there.
He comes on there quite a bit, and he shows up. I think he shows up to Thomas Lewis just to listen to some stuff. But yeah, okay. Thank you.
Okay.
Okay.
Dr. Bill, ready?
I'm ready. I got a question to ask Ross Pelton about a placebo arm of his veteran study. So it was in the chat and I missed it. So sorry about that. I will ask him that question when I write to him, and I will get back to it. Yes.
I thought you dozed off.
No, I'm here. I'm here. No, I only do that 2 or 3 times a day. You know that. All your prostate, remedies never work with you guys. So you get up 14 times a night, and you get a little sleep. about this time of day. All right.
HIPAA.
Huh? Well, I volunteered it, so it's not like you didn't tell anybody about it. I did. So, okay. Anybody else have any comments or questions? Okay, if you have anybody else that you want to recommend for speaking, we're always looking for speakers. We got some new folks coming up in the future, and some old favorites. And we'll see you again next week, same time, same station. Take care, Dr. Nario. Take care. Don't be a stranger.
Thank you.
And everybody here misses you. So, okay. And Joe, take care. Heal up. And we want you back here too. Okay. Okay. Good night, everybody.
Good night.
Right.
Thank you.
Thank